Medical Destiny uploads educational and informational videos related to health and medical topics. If you would like to get such kinds of videos, kindly subscribe our channel.
NCLEX-RN Exam questions with answers. (541). Which of the following are characteristics of case management? Select all that apply. 1. A case manager usually does not provide direct care. 2. Critical pathways and care maps are types of case management. 3. A case manager does not need to be concerned with standards of cost management. 4. A case manager collaborates with and supervises the care delivered by other staff members. 5. The evaluation process involves continuous monitoring and analysis of the needs of the client and services provided. 6. A case manager coordinates a hospitalized client's acute care and follows up with the client after discharge to home. Answer: 1, 4, 5, 6. Rationale: case management is a care management approach that coordinates health care services to clients and their families while maintaining quality of care and minimizing health care costs. Case managers usually do not provide direct care. Instead, they collaborate with and supervise the care delivered by other staff members and actively coordinate client discharge planning. A case manager is usually held accountable for some standard of cost management. A case manager coordinates a hospitalized client's acute care, follows up with the client after discharge to home, and is responsible and accountable for appraising the overall usefulness and effectiveness of the case-managed services. This evaluation process involves continuous monitoring and analysis of the client's needs and services provided. Critical pathways or care maps are not types of case management. Rather, they are multidisciplinary treatment plans used in a case management delivery system to implement timely interventions in a coordinated care plan. 542. A client is being admitted to the hospital after receiving a radiation implant for cervical cancer. The nurse takes which priority action in the care of this client? 1. Encourages the family to visit. 2. Admits the client to a private room. 3. Places the client on protective isolation. 4. Encourages the client to take frequent rest periods. Answer: 2. Rationale: the client who has a radiation implant is placed in a private room and has limited visitors. This reduces the exposure of others to the radiation. Protective isolation is unnecessary. Rather, individuals other than the client need to be protected. Frequent rest periods are a helpful general intervention but are not a priority for the client in this situation. 543. A client is to undergo weekly intravesical chemotherapy for bladder cancer for the next 8 weeks. The nurse interprets that the client understands how to manage the urine as a biohazard if the client states to 1. Void into a bedpan and then empty the urine into the toilet. 2. Purchase extra bottles of scented disinfectant for daily bathroom cleansing. 3. Have one bathroom strictly set aside for the client's use for the next 8 weeks. 4. Disinfect the toilet with household bleach after voiding for 6 hours after a treatment. Answer: 4. Rationale: intravesical installation involves instilling a chemotherapeutic agent into the bladder via a urethral catheter. This method of treatment provides a concentrated topical treatment with minimal systemic absorption. The client retains the medication for approximately 2 hours. After intravesical chemotherapy, the client treats the urine as a biohazard. This involves disinfecting the toilet after voiding with household bleach for 6 hours after a treatment. There is no value in using a bedpan for voiding. Scented disinfectants are of no particular use. The client does not need to have a separate bathroom for personal use. 544. A client who is admitted to the hospital for an unrelated medical problem is diagnosed with urethritis caused by chlamydial infection. The nursing assistant assigned to the client asks the nurse what measures are necessary to prevent contraction of the infection during care. The nurse tells the nursing assistant that 1. Enteric precautions should be instituted for the client. 2. Gloves and masks should be used when in the client's room. 3. Contact isolation should be initiated, because the disease is highly contagious. 4. Standard precautions are sufficient, because the disease is transmitted sexually. Answer: 4. Rationale: chlamydia is a sexually transmitted disease. Caregivers cannot acquire the disease during administration of care, and standard precautions are the only measure that needs to be used. Therefore, options 1, 2, and 3 are incorrect. 545. A nurse manager is reviewing the principles of surgical asepsis with the nursing staff. The nurse manager should tell the staff that it is necessary to use the principles of surgical asepsis in which situations? Select all that apply. 1. Removing a dressing. 2. Reapplying sterile dressings. 3. Inserting an intravenous line. 4. Inserting a urinary catheter. 5. Suctioning the tracheobronchial airway. 6. Caring for an immunosuppressed client. Answer: 2, 3, 4, 5. Rationale: surgical asepsis involves the use of sterile technique. Some examples of procedures in which surgical asepsis is necessary include reapplying sterile dressings, inserting N4 or urinary catheter, and suctioning the tracheobronchial airway. Medical asepsis, or clean technique, includes procedures to reduce and prevent the spread of microorganisms. Removing a dressing can be done by clean technique using clean gloves, although reapplying the dressing requires surgical asepsis. Caring for an immunosuppressed client requires medical asepsis techniques. 546. A nurse is preparing the client's morning NPH insulin dose and notices a clumpy precipitate inside the insulin vial. The nurse should 1. Draw the dose from a new vial. 2. Draw up and administer the dose. 3. Shake the vial in an attempt to disperse the clumps. 4. Warm the bottle under running water to dissolve the clump. Answer: 1. Rationale: the nurse should always inspect the vial of insulin before use for solution changes that may signify loss of potency. NPH insulin is normally uniformly cloudy. Clumping, frosting, and precipitates are signs of insulin damage. In this situation, because potency is questionable, it is safer to discard the vial and draw up the dose from a new vial. 547. The nurse is preparing the bedside for a postoperative parathyroidectomy client who is expected to return to the nursing unit from the recovery room in 1 hour. The nurse ensures that which specific piece of medical equipment is at the client's bedside? 1. Cardiac monitor. 2. Tracheotomy set. 3. Intermittent gastric suction. 4. Underwater seal chest drainage system. Answer: 2. Rationale: respiratory distress caused by hemorrhage, unswelling and compression of the trachea is a primary concern for the nurse managing the care of a postoperative parathyroidectomy client. An emergency tracheotomy set is always routinely placed at the bedside of the client with this type of surgery, in anticipation of this potential complication. Although a cardiac monitor may be attached to the client in the postoperative period, it is not specific to this type of surgery. Options 3 and 4 also are not specifically needed with this surgical procedure. 548. The nurse has a prescription to administer phoscarnet sodium intravenously to a client with acquired immunodeficiency syndrome, AIDS. Before administering this medication, the nurse should plan to 1. Obtain a sputum culture. 2. Obtain folic acid, folvite, as an antidote. 3. Place the solution on a controlled infusion pump. 4. Ensure that liver enzyme levels have been drawn as a baseline. Answer 3. Rationale: phoscarnet sodium is an antiviral agent used to treat cytomegalovirus retinitis in clients with AIDS. Because of the potential toxicity of the medication, it is administered with the use of a controlled infusion device. A sputum culture is not necessary. Folic acid is not an antidote. It is highly toxic to the kidneys, and serum creatinine levels are measured frequently during therapy. 549. An adult client who has a severe mental impairment is scheduled for gallbladder surgery. Which should the nurse implement about the informed consent first to facilitate the scheduled surgery? 1. Check for the identity of the client's legal guardian. 2. Inform the legal guardian about advance directives. 3. Arrange for the surgeon to provide informed consent. 4. Ensure that the legal guardian sign the informed consent. Answer 1. Rationale: a mentally impaired client is not competent to sign an informed consent, so the nurse should first verify the identity of the client's legal guardian. This action fulfills part of the nurse's duty in informed consent, helps avoid improperly signed documents, and directs the surgeon to the legal representatives of the client's interests. The client and/or legal guardian is asked about the existence of an advance directive at the time of admission, so this should have already been done, making option 2 incorrect. The surgeon is responsible for obtaining the informed consent, but based on the options provided, option 3 is not the first nursing action. Likewise, option 4 is not the first action. The nurse checks identity of the legal guardian first. 550. A client with an acute respiratory infection is admitted to the hospital with a diagnosis of sinus tachycardia. The nurse develops a plan of care for the client and includes which intervention? 1. Limiting oral and intravenous fluids. 2. Measuring the client's pulse once each shift. 3. Providing the client with short, frequent walks. 4. Eliminating sources of caffeine from meal trays. Answer 4. Rationale: in sinus tachycardia, the heart rate is greater than 100 beats per minute. Sinus tachycardia is often caused by fever, physical and emotional stress, heart failure, hypovolemia, certain medications, nicotine, caffeine, and exercise. Measuring the client's pulse during each shift will not decrease the heart rate. Additionally, the pulse should be taken more frequently than once each shift. Fluid restriction and exercise will not alleviate tachycardia and could exacerbate the condition. 551. Which action does the nurse implement to obtain a urine specimen for a urinalysis from a female client with an indwelling urinary catheter? 1. Detach the tubing of the drainage bag. 2. Use a sterile container for the specimen. 3. Cleanse the perineum from front to back. 4. Aspirate the urine from the drainage bag port. Answer 4. Rationale: a specimen for urinalysis does not need to be sterile. However, the indwelling urinary catheter system must remain sterile to reduce the risk of infection. Therefore, the nurse obtains the specimen using sterile technique and obtains a fresh specimen by aspirating urine from the drainage bag port after sanitizing the port and inserting a sterile needle. The nurse avoids breaking the integrity of the urinary collection system to prevent contamination. The nurse also avoids taking urine from the urinary drainage bag because the urine is less likely to reflect the current client's status and because urine undergoes chemical changes and particulate matter settles over time. A sterile container is unnecessary for a urinalysis, and because the client has an indwelling catheter, perineal cleansing before obtaining a urine specimen is unnecessary. 552. A nursing assistant is caring for a client who has an indwelling urinary catheter. The registered nurse provides directions regarding urinary catheter care and ensures that the nursing assistant 1. Loops the tubing under the client's leg. 2. Places the tubing below the client's knee. 3. Uses soap and water to cleanse the perineal area. 4. Keeps the drainage bag above the level of the bladder. Answer 3. Rationale: proper care of an indwelling urinary catheter is especially important to prevent infection. The perineal area is cleansed thoroughly using mild soap and water at least 3 times a day and after a bowel movement. The drainage bag is kept below the level of the bladder to prevent urine from being trapped in the bladder, and for the same reason the drainage tubing is not placed or looped under the client's leg. The tubing must drain freely at all times. 553. A nurse is assigned to care for a client with preeclampsia. The nurse should plan to initiate which action to provide a safe environment? 1. Maintain fluid and sodium restrictions. 2. Take the client's vital signs every 4 hours. 3. Turn off the room lights and draw the window shades. 4. Encourage visits from family and friends for psychosocial support. Answer 3. Rationale: clients with preeclampsia are at risk of developing eclampsia. Bright lights and sudden loud noises may initiate seizures in this client. A woman with preeclampsia should be placed in a dimly lighted, quiet, private room. Clients with preeclampsia have decreased plasma volume, and adequate fluid and sodium intake are necessary to maintain fluid volume and tissue perfusion. Vital signs need to be monitored more frequently than every 4 hours when preeclampsia is present. Visitors should be limited to allow for rest and prevent overstimulation. 554. A client is scheduled for a bronchoscopy. The nurse plans to implement which priority measure? 1. Asking the client about allergies to shellfish. 2. Obtaining informed consent for an invasive procedure. 3. Restricting the diet to clear liquids on the day of the test. 4. Administering pre-procedure antibiotics prophylactically. Answer 2. Rationale: bronchoscopy is a procedure in which the physician uses a fiber optic bronchoscope for direct visualization of the larynx, trachea, and bronchi. Because the procedure is invasive, it requires that informed consent be obtained from the client. It is unnecessary to inquire about allergies to shellfish before this procedure, because contrast dye is not injected. The client is kept NPO for at least 6 hours before the procedure. There is also no need for prophylactic antibiotics. 555. The nurse hangs a 1000 ml intravenous solution of 5% dextrose in saline at 9 a.m. and sets the infusion controller device to administer 100 ml per hour. On assessment of the fourth infusion, the nurse expects that the safe amount of solution remaining in the fourth bag at 2 p.m. will be represented at which level? Mark the answer on the line provided. Answer 500. Rationale: the nurse hangs an fourth solution at 9 a.m. and sets the fourth solution to infuse at 100 ml per hour. At 2 p.m., 5 hours later, the nurse would expect 500 ml of solution to be safely infused. 556. A nurse is planning care for a client with acute glomerulonephritis. The nurse instructs the nursing assistant to do which of the following in the care of the client? 1. Ambulate the client frequently. 2. Encourage a diet that is high in protein. 3. Monitor the temperature every 2 hours. 4. Remove the water pitcher from the bedside. Answer: 4. Rationale: a client with acute glomerulonephritis commonly experiences fluid volume excess and fatigue. Interventions include fluid restriction as well as monitoring weight and intake and output. The client may be placed on bed rest or at least encouraged to rest, because a direct correlation exists among proteinuria, hematuria, edema, and increased activity levels. The diet is high in calories but low in protein. It is unnecessary to monitor the temperature as frequently as every 2 hours. 557. The nurse is caring for a client with a C6 spinal cord injury during the spinal shock phase. The nurse should implement which of the following when preparing the client to sit in a chair? 1. Applies knee splints to stabilize the joints during transfer. 2. Teaches the client to lock the knees during the pivoting stage of the transfer. 3. Administers a vasodilator in order to improve circulation of the lower limbs. 4. Raises the head of the bed slowly to decrease orthostatic hypotensive episodes. Answer: 4. Rationale: spinal shock is a sudden depression of reflex activity in the spinal cord that occurs below the level of injury, areflexia. It is often accompanied by vasodilation in the lower limbs, which results in a fall in blood pressure upon rising. The client can have dizziness and feel faint. The nurse should provide for a gradual progression in head elevation while monitoring the blood pressure. Clients with cervical cord injuries cannot lock their knees, and the use of splints would impair the transfer. A vasodilator would exacerbate the problem. 558. A nurse notes that a client's lithium level is 3.9 mg per liter. The nurse should implement which priority intervention? 1. Determining visual acuity. 2. Assisting with ambulation. 3. Monitoring intake and output. 4. Instituting seizure precautions. Answer: 4. Rationale: the lithium level must be monitored closely in a client taking lithium, lithorbid. A therapeutic regimen is designed to attain a serum lithium level of 1.0 to 1.5 mg per liter during acute mania, and levels of 0.6 to 1.4 mg per liter for maintenance treatment. A level of 3.9 mg per liter is in the toxic range, and seizures may occur at levels of 3.5 mg per liter and higher. Options 1, 2, and 3 are appropriate interventions but are not the priority. 559. A hospitalized child develops a rash that covers the trunk and extremities. The nurse reviews the child's health history and notes that the child was exposed to varicella 2 weeks ago. The appropriate nursing intervention is to 1. Immediately admit the client to any available bed. 2. Place the child in a private room on strict isolation. 3. Assess the progression of the exanthema and report it to the physician. 4. Allow the child to play in the playroom until the physician can be contacted. Answer: 2. Rationale: the child with undiagnosed exanthema needs to be placed on strict isolation. Varicella causes a profuse rash on the trunk with a sparse rash on the extremities. The incubation period is 14 to 21 days. It is important to prevent the spread of this communicable disease by placing the child in isolation until further diagnosis and treatment are made. Options 1 and 4 are inaccurate, and option 3 is not the most appropriate intervention. 560. A nurse watches a second nurse performing hemodialysis on a client. The second nurse is drinking coffee and eating a donut next to the hemodialysis machine while talking with the client about the client's week. The first nurse should take which action? 1. Get a cup of coffee and join in on the conversation. 2. Determine whether or not the client would like a cup of coffee. 3. Admire the therapeutic relationship the second nurse has with the client. 4. Ask the second nurse to refrain from eating and drinking in the client area. Answer. 4. Rationale. A potential complication of hemodialysis is the acquisition of dialysis-associated hepatitis B. This is a concern for clients who may carry the virus, client families at risk from contact with the client and with environmental surfaces, and staff who may acquire the virus from contact with the client's blood. This risk is minimized by the use of standard precautions, appropriate hand washing and sterilization procedures, and the prohibition of eating, drinking, or other hand-to-mouth activity in the hemodialysis unit. The first nurse should ask the second nurse to stop eating and drinking in the client area.
Thanks for watching. If you like this video and you would like to watch similar videos in future, please subscribe our channel and tap the bell icon.